This week we're continuing with the calcareas. Calcarea phosphorica is today, which is a great bone remedy. Uh, let's see, one, two, three, and I think four. Yeah, there's four more, so that's going to carry me through the week. So we're going to finish off the week with calcareas, then we're going to get into calendula next week, which is a great remedy for all kinds of skin healing. So Calcarea phosphorica, while exhibiting strong points of resemblance with Calcarea carbonica, which I did recently. Calcarea carbonica is one of the main ones, and Calcarea phosphorica. Some of these other ones, like I did eggshell on Friday, which is Calcarea oviteste, and Calcmuratica, that's another smaller one. Iodata was a smaller one. There's a bunch of smaller ones. Calc-Flor is a bigger one. Calc-Carb's a bigger one. And Calc-Phosphorica. When I say a bigger one, they're more like polycrest. They're used for more situations than the smaller ones. Now, is that because they're not as good of a medicine like the eggshell? Well, the eggshell could be better, but it's not to say it was proven. The preparation has been used in preference to other cases of simple bland leucorrhea. So, yeah, I don't think that one hasn't been proven. So if it's been proven like this one, it has the mind, the abdomen, the back, and what this is the materia medica, which is what I basically go through. And learning the materia medica or the medicines in the materia medica, what they're good for, always helps you when you're looking at someone's situation, what they have. I just seen homeopathy plus, I think it's called. They just said the singer for Who, what the heck's his name again? Anyways, his son was gonna die or whatever, and he's an advocate now for what the heck is his name? An advocate for homeopathy because it saved his son's life. And I've seen many of people um, uh, get through situations with homeopathic medicine. And the main thing for me is I want to get this into everybody's mind that they understand homeopathy. I want to reach out to our Pennsylvania representative. God, I'm having trouble with names today. Anyways, he's had a stroke and he just fell down and hurt his face. And there's a couple medicines that, if he would consider them, it would help him through that stroke situation. But while exhibiting strong points of resemblance with Calcarea carbonica, Calc-Phos has nevertheless a very distinct individuality. It has been proved and tested clinically. So that's why I say some of these medicines are proved, and others are even not only proved but tested clinically with clinical patients. And having been adapted to Scholzer does a lot of cell salts and stuff. Now, he's a homeopath, as his leading anti-psoric remedy. That's there's psoric, there's tubercular, there's um, psychotic, and these are all miasms. These are things that get set up from diseases, whether our parents had them or we've had them. They get it sets up a situation in our body. Like tubercular would be a lot of lung stuff. Psoric, which this is a lot of uh, bone and skin and different things like that. So a number of valuable indications have been added by him and his followers. So they added it. The Calc-Phos patient is generally emaciated. So they're very thin instead of fat like the typical calc-carb one. So calc-carb, you see a patient come in, they're heavy set, you think of calc-carb. They come in, they're thin, and it doesn't have to, there's a lot of remedies that would be considered in the heavy set, but they come in thin, then you'd think of Calc-Phos. The Calc-Phos patient is less chalky white also, so the skin's less, Calc-Carb is chalky white, but the Calc-Phos is dirty white or brownish, their skin, than the Calc patient. Both have large abdomens, so the abdomen's distended, but that of the Calc-Phos patient is flabby. So the Calc-Carb patient isn't so flabby, but the Calc-Phos is more flabby. Calc uh, carb has craving for eggs, where calc phos. Now, this is the way you differentiate. Not only do you use modalities like I have up here, better summer, some other ones are better winter, and rest and worse cold, damp weather, all that kind of stuff. So, um, this patient, the calc carb patient, to differentiate, they crave eggs. The calc phos patient, they crave salty smoked meats. They want fat and bacon, all the salt and the fats and all that stuff. In children is a well-verified characteristic of calc phos. Calc phos has cured dyspepsia, which is heartburn, pain better for a short time by raising wind, by burping. When fasting, the pains go to the spine. So these pains go from the either the head to the spine or from the stomach to the spine, feeling as if one ought to raise wind or burp and could not. So they can't burp, but with the dyspepsia, they have an indescribable distress in the region of the stomach, only temporarily better by eating. So they eat, and even eating's a problem for them. As you'll see, they eat and they get distressed, but they have this heartburn and they eat something and it makes it feel better for a while. But they have a hard time burping, but when they do burp, it does relieve that dyspepsia. The stools of calc phos, and I talked to my dad. I said, "What are you eating?" He said, "Oh, I'm eating a Tums." So he was having dyspepsia or heartburn. I wish they uh, believed in homeopathy like most people don't. This is why God gave me this, to push this thing, because it's hard to get people to realize the power of these medicines. And actually, the medical community is realizing the power of it, because the FDA has been going after it since like 2017, saying they're unproved medicines. So then you have to go back and you have to do all these these studies that cost millions of dollars, and you cannot patent these medicines because anybody can make them. I can go out and make it. I can take an eggshell and make the Calcarea ovi teste, which is the eggshell. I can make that medicine myself. So, anyways, they're realizing how powerful these medicines are. And one of the homeopathic groups I'm in, they said, yeah, they're starting to use small doses, but they're not calling it homeopathy. They're calling it something else. So they may go that way. And if they do, power to them, because the drugs they're using now is causing more problems for people. The stools of, and not antibiotics saved lives, but the overuse of them is harming people. The Calphos stools are green, slimy, or hot and watery with fetid flatus. So the farting stinks. And it's a green stool and it's slimy and hot. Calcarb sometimes is green, generally watery, but it's white and mixed with curds. So it's like an egg white with curds. Calcarb has an open anterior fontanelle. That's the stuff in the head, where the bones come together. Our bones in our head aren't solid. Calphos has both open, especially the posterior. The skull is thin and soft. So these medicines do have similarities, but there is some differences that you can tell between them. Almost cracks like paper when pressed upon. So yeah, it's moving basically, and it's like cracking like paper. Guavagal, which is a homeopath, considered it the most important remedy in chronic hydrocephalus, which is the inflammation of the brain with fluid retention. And he very properly gave it as a prenatal remedy during pregnancy to women who had previously born hydrocephalus children. So this is what they give it like a, even when diseases come by, to give it like a vaccine. What do they call that? Um, Anyways, to give it like a vaccine when you see the measles coming around like it has been, you give people morbillinum, which is the measles nosode, and that would be like giving a vaccine almost. And this guy was giving it in a woman that's pregnant that ended up, when their baby came out, they had this hydrocephalus, this water on the brain and that. Patients, especially children, are delicate, tall, thin, or scrawny with dirty brownish skin. It is suited to scrofulous, which is tubercular miasm, gouty constitution, anemic children who are peevish, flabby, have cold limbs and weak digestion. They start convulsively when lying on back, better lying on side. They lose breath when they are lifted. Okay. So Calcarea phosphorica, nutrition of the bones, and that's phosphoric acid that's dropped into calcarea stuff. Anyways, that's not even necessary. Nutrition of bones. They become soft, thin, and brittle. So osteoporosis, all kinds of things like that. So very nutritious for bones. And like I was saying, they were the children in Syria. They were deprived of nutrition after a war. They had trauma in that. They sent a kid over, and they got them on Skype because at this time Zoom wasn't big. And these people were, they would come up and they would get on the camera, and the children would, talk to them, and they would say, "Oh, look, go get this." So now, not having the nutrition, they would give things like calcarea phos, silica, calc fluor. They would give a lot of these cell salts to them, and their nutritious value would become better. So this is a great nutritious remedy for bones. Same with calc fluor and a few other ones. Anyways, slow development of teeth. So when the teeth aren't developing, dentition isn't happening too quick, you think of calc phosphorica. Non-union of fracture of bones. These are all threes. So when the bones, you have a fracture and it doesn't heal, and fractures are harder to heal than an actual break. If you have a break, this would be one to consider too. But fractures don't heal as good. You would consider giving this in a low dose over a pretty long period of time. It's better in summer. This person hates the winter. Better rest. Worse in cold, damp. So any cold dampness, and if the snow melts, if they have snow and it melts, that dampness and that coldness really bothers them. Worse motion, worse lifting, that hurts their back and all that. Worse lifting and being lifted, as you've seen, I read. Loss of fluids. So any fluids, whether they're sweating, semen, diarrhea, leucorrhea from the woman, those kind of things, they're worse from it. Causation, overgrowth. Any overgrowth of bones, of things, lifting. And the overgrowth can be on the skin, it can be on the bones, it could be, that's where gout and all these things come in. Worse lifting, they hurt themselves lifting. Grief, worse grief. Disappointed love, bad news. So any bad news, any grief, any disappointed love really bothers this person. That causes these symptoms to take hold. They're peevish, fretful, thinking is difficult. They're forgetful from grief. Ignatia and phosphoric acid has this, when they have grief, it becomes very forgetful for them. Ignatia, phosphoric acid, and calcarea phosphorica. Colic, that's a 3 for that. Any kind of stomach issues or abdomen issues in that. Attempting to eat, they have a problem with they get colic when they attempt to eat. That's why I say eating makes the dyspepsia feel better, but it also can cause this, it gives them that colic. Sudden, sunken, flabby, the abdomen is sunken and it's flabby. It actually should be distended, but that's a 3. Worse from fruit and cold water. They can't take cold water in, and fruit makes the whole abdomen thing, the colic and that worse. Curvatures of spine to the left, that's a 3. So anybody having, their spine basically curves to the left, they would, it goes up straight and then it curves to the left and finishes. Any of that, that's a 3 for calc phosphorica. And anybody having spine issues. Violent pain in the back, worse least effort. So that's that lifting, any movement, and that least effort bothers them. Now, if they've injured themselves and at least effort is worse and it's a violent pain, you'd think of calc phosphorica. And there's a few of them that would, Bryonia, Rostox, a bunch of them could be in that realm. So you'd have to differentiate between all these medicines. So we don't have like, you got a backache, you take ibuprofen, or we give you opioids. That isn't the case. We have a bunch of medicines for back injuries, bryonia, rustox, calcphos, a bunch of them. Then you have to differentiate and find out which one would be best for them. Chest, sore pain in lower left lung. So this could be the tubercular stuff going on, but they have a sore pain down in there. They have defective hearing, sudden swelling of external ear, so the ear would suddenly swell, and they have a cold feeling in there. And after they go to the bathroom, have a stool, they get noises in their ear. Those are very weird symptoms that would lead you to phosphorica. Cold feeling in the eyes and behind the eyes. So there's a cold feeling. Was it? Yeah, and a cold feeling in the ears. So there's a lot of cold feeling with this. I think it's cold in the limbs. Cold. Let's see. Diffused opacity. So the eyes, and that if they get an abscess in their eye, then they would have this opacity. And that opacity is when you look at someone's eye, it's kind of opaque. It's whitish looking, basically. So they're probably having trouble seeing. Pale, yellowish, earthy looking skin. It's not, it's pale, but it's yellowish and earthy looking, more darker. Full of pimples, cold sweat, upper lip is swollen, prolapsed. Oh, this is all women's. Okay, so upper lip is swollen. They have a cold sweat on them. Their face is full of pimples, and it's an earthy, yellowish, pale look. Menses are bright, then dark. So if they're scanty, they're bright. If they aren't scanty, not scanty, but if they're profuse, that's what I was looking for. Then they're bright. If they're not profuse and they're the menses aren't coming on as strong, then it becomes dark with a violent backache. That's the key there. Violent backache with their menses. Calcphos, and like I said, there's a bunch of them. And like I say, with allopathic medicine, they would give you ibuprofen, opioids. I don't know what else they have for backache with the menses, but we have a bunch of them. So you'd have to differentiate which one would be best for this lady that's having menses and having that violent backache. Now, their leucorrhea, which is a discharge in between menses, is like egg white. That's a 3. There's no smell, there's none of that, but it's a white discharge from the vagina. They crave bacon, ham, salted or smoked meats. That's a 3. And like I said, the Calcarea patients differentiate. They're more heavy set and they crave eggs. Where Calcphos, they're more thinner and they crave these meats, smoked meats and that. Abnormal cravings during pregnancy. So it doesn't say sour things. So probably a lot of this stuff is them abnormal cravings. Some women would crave like pickles and things, sour things. That would be a whole different medicine. Headaches, worse near the region of the sutures. So like I said, where the bones come together up in the head, that headache would be painful up there. Sometimes headaches are in the front and that can be sinus. Sometimes it's in the back. And it's also from change of weather. That's a 3. So change of weather with, the pain being near the sutures, that it's worse near the sutures. It can be all over the head, but worse near the sutures and change of weather. That's all 3. And it's good for hydrocephalus, which is the edema of the brain or swelling of the brain from fluid retention. Dropsy from heart disease. Dropsy is, once again, fluid retention, right? Yeah. Anyways, palpitations with trembling and weakness in the calf. So they'd have trembling on the, over in the hands, and it could be the legs and the rest of the body. And they have a weakness in the calf, so they're not very stable when they're walking. Kidney urine is increased with sensation of weakness. So there's that weakness, a lot of weakness with this one, and a lot of, that's that peevishness, and they just, not very vitally strong, these people. But when it's increased, they get a weak sensation of weakness. Pain in the kidneys, worse lifting. So they lift anything, then pain in the back and the kidneys is worse. Pain in the bladder, especially when the bladder's empty. You know, they urinate and now they got a pain back there because the bladder's empty. Uh, Rheumatism, and you could see, you know, asking somebody questions, you know, about what's going on. So, you know, you'd go through all the questions to find out what's going on with them. And, you know, yeah, when I get a pain in my back there when my bladder's empty, you know, pain when I lift anything in my back, you know. So, you know, you'd have to determine, is it the kidneys? They have a bladder situation going on? Rheumatism in cold season. Now, you don't have to determine a lot of these things, but you will, from some of these symptoms, you could, you know, you could just take this desire for smoked meats, headache up in that area of the thing, maybe a curvature of the spine or colic. Everything's worse in summer. They're having bone problems. That would lead you to this medicine. You wouldn't have to know if the pain's in the bladder or the kidneys. The only way you're going to know that is, you know, by, you know, where it is, number one, where the kidneys are, where the bladder is, you know, and then, you know, might have to have tests done. So if you're not having doctor stuff or not able to get those tests done, you can right away just determine where that pain is. It could be the kidneys, it could be the bladder. Okay. Rheumatism in the cold season. So that's why they don't like cold. They're better in the summer. And especially if it's damp. So the joints will be a problem. Stiffness and pain. Now that's a Russ Tox situation. That's why I say there's a few medicines that can be for a lot of this rheumatism and stuff. You'd have to determine which one it is. You know, you go to stiffness and you give Russ Tox, it's not working, you might consider Calc-Phos. With cold, numb feeling. So there's this cold, numb feeling in the joints and the bones. Worst change of weather. So any change of the weather really makes it worse, especially from warm to cold and wet to or dry to damp. These kind of changes of the weather really makes the stiffness worse and the numb feeling, you know, giving them that numb feeling, that cold, numb feeling. Pain, and there's no liver, but pain in the joints and bones. So that's why I say a lot of joints and bones. Hip joint disease. Aeschylus is a very good one. I gave it to a lady. She was in a wheelchair and I was doing her marble and I was just learning homeopathy and I knew Aeschylus was good for the hip. And I said, you know, what's your problem? She was, I don't know what she said. I don't even remember. I just was thinking Aeschylus. Now that's bad to do. You really should kind of take the case. But I was just, I want to say experiment. So I said, you know, because it's all natural and can't harm her. I said, would you would you be willing to take a medicine if I give it to you? It's all natural. There's no side effects. Yeah, gave it to her. Pound it, sip it, pound it, sip it. Gave it to her in a bottle. The next day she was standing, not in her wheelchair. She said, my God, what did you give me? My pain is 90% gone. You know, and that was Aeschylus I gave her. So like I said, hip joint disease could have been Calc-Phos. I could have missed, you know, and she would have been like, ah, that didn't work. But yeah, I basically removed the pain, but I said, lady, don't do nothing because you have something wrong with your bones, your joints, whatever's going on in there. I don't know. It would have probably been like this. I would have been given Calc-Phos to build up to repair the bones, or calc floor could have repaired the bones. One of them could have been used to repair the bones while the Aeschylus was given to remove the pain. So hoarseness and a cough, worse lying down during dentition. So this cough is worse when they're teething, when they're having teeth problems, when they're lying down, and it comes with a hoarseness, uh, and it's suffocative. You know, they're coughing and it's suffocating. This can be in tuberculosis, a cold, a flu, whatever, but this is good for tuberculosis. They have yellow expectoration. So the mucus is yellow coming out. That can be colic, hepasulf, what's the other one? There's a few of them. Hepasulf, yeah. Anyways, Calibic, Califos. It could be a few of them with that yellow mucus. Pain in chest from drafts. So any cold air coming on them can hurt the bones, can hurt, you know, give them a pain in the chest, can bring on that cough. And it's a whooping cough that is obstinate. They can't get rid of this whooping cough. You would consider Calc-Phos. Male, stitching in perineum, which extends to the penis. Erections in riding and caress. Any bumping and riding around and movement will give them erections. And there's a lot of nymphomania for the woman, for the man in this medicine. Retarded dentition, so they don't, that's a 3. They're, uh, their teeth don't come in as quick as they should. They have, their teeth can become soft, decay easily. So the dentition is very bad with this. And growths on the adenoids, that's a 3. And that causes them to not being able to open the mouth. Nose tip icy cold, a lot of coldness with this remedy. There's a lot of coldness all over the body. Polyps are large, pedunculated. Pedunculated means it's got a, it's almost like a mushroom, we'll say. It grows a stem and then it has a head on it. That's pedunculated. Coryza with salivation, so a lot of coryza in the nose with salivation in the mouth. Bleeding after hard stools, so they're really, if this can be in like a constipation. Fistula in the anus, which is like a tunnel. So in other words, they would have leaking into other parts of the it's like a tunnel in the anus where the stool would leak into other parts. Alternates with chest symptoms. So this stool stuff alternates with chest symptoms. So any kind of this coughing, this stuff, they would have chest symptoms or stool rectum symptoms with it. Hemorrhoids that are oozing, watery fluid all the time. So their hemorrhoids are always oozing. And the stool is hot, fetid, which means smelly, uh, and a lot of flatus, a lot of farting that's hot and smelly. So that's what the stool is like. And the skin is dark brown or yellowish. Scars from amputation, any of them scars, you would consider calc phos for the, after something's amputated, whether it's cut off at work or whether it's amputated because of gangrene or something, you would consider calc phos. And for ulcerations of the skin, any kind of ulcers. So back to the medical. Uh, Growing pains, any growing pains, that's a 3. People that are just have these pains because, they're outgrowing what's going on with their body. Osteomyelitis, which is an infection of the bones. Osteoporosis, which is, we know that's um, bones losing calcium. Those are all 3s. Involuntary sighing. They can't get their breath, so they're always sighing. And they're always yawning and stretching, as you'll see with the sleep. Enlarged tonsils, and crawling and numbness. That crawling and numbness is the arms, legs, whatever goes to sleep. Things go to sleep on them. Breast, the milk is salty, which the baby doesn't like, it spits it out. Tumors of the breast, even in a male, and it's of the left breast, most likely. It's usually left breast, left spines going to the left. I think there's more left stuff. So this is a lot of a left-sided, a lot of things with this remedy. Bones, non-union, that's a 3. Any broken bones, you want to reunite them, calc phos, calc fluor, those ones are all good for that. Rickets, which is, lack of vitamin C, the bones become slow ossification, which is the bones growth. The growth of the bones is very slow. So a lot of growth with the bones, a lot of teeth stuff, all that kind of stuff. If you break a bone, this will help. Symphytum is a great one to knit that bone together quick, but you might consider calc phos for to help with that too. Painful from drafts in the neck, weak and thin. So the neck's weak and thin. It has a hard time holding up the head, and any kind of pain, they get pain, any kind of drafts come in. So they really can't stand drafts. And the guy I worked with, it'd be 90 degrees and he couldn't take the fan on him. He wouldn't even turn on a fan. Constant stretching, yawning, cries in their sleep. They can't wake up in the morning. So they're having a lot of this trouble in their sleep and they have a hard time getting up. Weak digestion. Every bite hurts their stomach. Vomits while hawking mucus. So they're trying to get that mucus out, that yellow, thick mucus out, and they're throwing up because of it. Much flatulence, which is farting. Heartburn, temporarily relieved by belching. So they burp and it helps with that heartburn. Easily chilled with pain running up the back. Sticky, thick sweat, worse head, throat, at night. So the head and the throat has a sticky sweat, worse at night. Sore aching in the throat, feels hollow. Swollen tonsils, can't open mouth from pain, and that can be from the adenoids and the tonsils. And I got a few minutes. This one's going to go a little longer because it is a big medicine, and I want to get it into my group. Let's do this, man. I'm not going to try to bend over and do that. Welcome to my room. Over here, got all that's my setup. Got my books, my guitars. That there's what's it say? I will both lie down in peace, sleep. You alone, Lord, make me dwell in safety. That's Psalms 4:8 up there. I think my mother got that from a play up in Eastern PA. All right, so where am I? Comments. Kelp Foss is useful in cases of fistula, which is that tunneling. When fistula has been operated on and symptoms have appeared elsewhere. So this fistula will keep popping out. And that's a thing, like this kid in Shaler, he had cancer of his shin, and I guess they operated on it, they took care of it, well, it came out again. The body's trying to push something out. Homeopathy will help the body finish pushing that out, clear it up, unlike you go in, you cut it off, or you give a drug and it doesn't take care of it, because this cancer kept coming out. Now his leg was cut off, and the story, why they did the story, is because now he's doing track and doing these things with them metal feet, metal leg things. So they keep operating on it, and it keeps coming back. Fistula alternating with chest symptoms. So that's that anus and chest symptoms that are related. Enlargement of tonsils, acute and chronic shortness of breath, involuntary sighing. And that's why they're sighing, because they can't catch their breath. And they're stretching and yawning. Contraction of chest and difficult breathing in the evening until 10 p.m. So after 10, they get better, I would imagine. Better lying down, worse getting up. Constant stretching and yawning, crying out in sleep, cannot get awake in the morning. Many of the uterine symptoms are like those of sepia. Sepia is a great woman's remedy for a lot of uterine stuff. So Calc Foss, sepia, and there's a few other ones you would consider. There is a weak sinking sensation in the hypogastrium and a sinking empty feeling in the epigastrium. Epigastrium is the lower part of the abdomen, and hypogastrium is the upper part. So there's a sinking sensation in the entire abdomen. Prolapsed uterus, this could be good for, like sepia. Sepia is great for a prolapsed uterus. Worse during stool or urination. That's when the uterus, the prolapse really comes, bothers them when they're going urinating or having a stool. Aching in uterus, cutting through the sacrum. So the back pains with the lady stuff. Cream like leucorrhea, that's that white like egg leucorrhea in between the periods. Burning in vagina with pain on both sides of bladder and uterus. Burning like fire, so there's a lot of burning with this one. Up into chest, flushes of heat and faintness, sweats easily, but the menses are profuse and the patient is weak and tubercular. So that's just the tubercular miasm. She has, and they're very weak. These patients are very weak. She has partial profuse sweats, but less profuse than those of sepia. So sepia is really profuse, and Calc Foss isn't as profuse. Every exposure increases the rheumatic pains of Calc Foss. When they say exposure, they mean like cold winds, coldness, dampness. That really brings out the rheumatic pains and the uterine distress. So both the rheumatic and the uterine distress is worse from cold winds, damp weather, all that kind of stuff. Defective bone growth. Bones are thin and brittle, so that's why I say Calc Foss, Calc Floor, all these ones, even calcarb, there are a lot of them are good for the bones, but this one, Calc Foss and Calc Floor, are big ones for that. The sexual organs are the center of many symptoms. Nymphomania, all organs in erection with irresistible desire. I don't know what all organs is, but they get an erection and they have an irresistible desire, particularly before menses. Now, of course, the erection is I don't know. It could be a lady's clitoris being erect. I don't know, but anyways, men's erection, the woman and that before menses, they get this great desire. And as you it said, riding in a carriage, the man gets an erection, gets all worked up. Voluptuous feeling as if all the parts were filled with blood, pulses in all the parts with increased desire after urination. So a lot of blood flowing down there, and when they urinate, they may get that desire also. The chills of calc phos strike upward. Herring's a homeopath. The chills run up the back, terrible muscular jerks in the body. That can be that epileptic stuff, which almost throws him out of his chair. So the relationships are calcarea, carb, silica, calcarea hypophosphorus. Effects of cutting wisdom teeth is cherianthus, colchiolum, conchiolum, which is mother of pearl, has a wide range of action in bone affections, especially when the growing ends are affected, which is osteoitis. So that's that mother of pearl, which is inside and calcarb comes from the shell of the what is that oyster. But the pearl inside this cochiolin, hard to say these words sometimes, is good for the growth in the ends of the bones when they aren't growing well. Serenum and sulfur is also a good one. Ruta's complementary, and same with Hepar sulf, which is the Hepar sulf has that yellow mucus in that. So, all right, that is morning medicine. You can age, but you don't have to get old unless you eat wrong and move wrong and stressed out.